My name is Mark Rubin, and I'm the director of the Institute of Precision Medicine and the chief of the Division of Molecular and Genomic Pathology at Weill Cornell Medical Center. The prostate gland, when healthy, really is predominantly involved in reproductive functions, and so is really something you would not even know existed. Only when it becomes disease is it causing problems with urinary retention and, in some instances, the development of cancer. The identification of the likelihood of prostate cancer may be through prostate-specific antigen or PSA screening, but the definitive diagnosis has to come through a prostate needle biopsy or another surgical procedure where the diagnosis is made on tissues. These are evaluated by a pathologist, and it's extremely important to accurately diagnose the cancer as well as the extent of the cancer. Prostate cancer is a particularly challenging disease today. It's a very common disease. Around 250,000 men are diagnosed in the United States each year with prostate cancer. We want to identify the advanced or aggressive disease as early as possible. Accurate pathologic diagnosis is really one of the keys to this. Once you have a diagnosis of prostate cancer, there are some important deciding factors having to do with the amount of cancer and the grade of the cancer. And based on these decisions, you will either be recommended for surgery or radiation, so definitive therapy, or active surveillance. So these are very, very different treatment options. And that's why we strongly recommend having more than one individual review this, because these are critical cut points where you have to decide what to do based on grade and amount of tumor. Our pathology department is really an outstanding environment for clinical care. We see a very large number of patients each year at Weill Cornell Medical College. The number of patients also represents number of challenging patients that we see. So our pathologists have a lot of experience in seeing cases, but also seeing challenging cases that are sent from other institutions. The other important component of how our pathologists work is we work closely with the clinicians, the surgeons, the radiologists. This is extremely important because we understand the implications of our diagnoses, and we work closely with our colleagues to make sure that the information is interpreted clearly and correctly so that they know exactly the best course of treatment for their patients.